Hi, my name is Alice, and I am privileged to present my collaboration and leadership reflection video. My presentation will cover several subtopics, including number one, an interdisciplinary collaborating experience I have had in the nursing profession, indicating ways it was successful and unsuccessful. Number two, how poor interdisciplinary teamwork can result in insufficient management of a patient and financial resources. Number three, best leadership strategies that would improve an interdisciplinary team's ability to achieve its goals. And number four, best practice interdisciplinary collaboration strategies to help a team to achieve its goals. The nursing profession comprises of multiple healthcare professionals. Their purpose is to provide quality and safe services that improve patient outcomes. However, for effective results, the healthcare providers need to collaborate and work as a team. Physicians, informatics, pharmacists, nurses, nutritionists, psychologists, pediatrics, and others require collaborating in this provision of healthcare services. Interdisciplinary collaboration enhances patient satisfaction and provides an opportunity for healthcare professionals to learn from each other and interact. The process also provides an opportunity for healthcare workers to develop personally and professionally. Bosch and Mansell, 2016. Additionally, multidisciplinary collaboration enhances good working relationships that improve staff relationships and job satisfaction. Finally, it reduces insufficiencies and expenses. The case I have experienced that interdisciplinary collaboration has been successful was of a patient that was 78 years old. He's a male and he arrived at the hospital in an ambulance due to heart failure. He had shortness of breath. His legs, ankles, and feet were swollen. His heartbeat was irregular. He felt fatigued, he had a persistent cough, and he was wheezing. He also had gained a lot of weight due to fluid retention. He felt severe pains in his chest, and he lacked an appetite. He had been transferred from a local hospital in his neighborhood. On arrival, the nurse manager received and administered oxygen as an order from the doctor. The doctor conducted a physical examination and ordered blood cultures. He ordered a chest x-ray and an echocardiogram to ascertain that it kind of correlated with the diagnosis of his health issues. The laboratory technician and the radiologist collaborated and performed the test that was required by the physician. After the diagnosis, the physician requested that the nurse administer an ACE inhibitor and a beta blocker. The nutritionist helped in the meal planning of the patient and advised him of the impact of smoking and alcohol intake. Because of his edema, the physical therapists provided their therapy to reduce the inflammation. They also advised on best physical exercise that the patient could be engaged in to reduce his weight. Additionally, the physician concerned recommended a bedside nurse who was assigned to the patient. The bedside nurse role was to ensure that the patient does not involve himself in a hospital acquired fall and not place himself as a fall victim. It is significant to note that the pharmacist also collaborated with other healthcare professionals by providing the drugs provided and the dosage. The nurses coordinated the team and acted as a point of communication between the patient and the other healthcare professionals. Furthermore, the nurse mentioned if the patient followed all the guidelines of the specialist, he would get better. Finally, the nurses set patient-centered goals that were to be achieved after some time. By the end of the month, the goals were that the patient would be feeling better, of course. He had reached the severity of health conditions, medications, together with the dietary guidelines and physical exercise provided to the patient, help the patient to have a positive patient outcome. Nonetheless, collaboration was not completely successful because there should have been a respiratory therapist that was on board. And though he was not around, this could have been, in his opinion, may have been of help to the patient. The poor collaboration of nurses can heavily impact an organization. First, it can lead to insufficient management of humans. Workers do not receive collaboration from their leaders, are prone to be resistant to change, leading to insufficient management of humans. Secondly, poor collaboration can lead in the use of high financial resources. The ineffective interprofessional collaboration of healthcare professionals is prone to result in medication errors and challenges in the system that might require financial resources to correct them. For instance, based on case experience provided, poor communication would have led to the development of severe cardiovascular conditions or death of this patient. Chronic issues need more financial resources to correct them. Hospitals are no longer tolerating mediocre outcomes. Thus, they need to provide and invest in good leadership strategies to improve multidisciplinary ability. According to Hamilton, Huber, Shashkuski, and Hebb 2018, numerous leadership strategies can be implemented to improve interdisciplinary abilities to achieve set goals in an organization. First, shared decision making. It is integral strategy that would help team members to collaborate. The survey revealed that leaders who use democratic, team liaison fair form of leadership are prone to enhance collaboration and in comparison to those who use authority or authoritative mode of leadership. Therefore, leadership styles that include other team members in making vital decisions concerning the organizations have higher chances of promoting collaboration. Communication is another vital leadership strategy that would enhance a multidisciplinary ability to achieve the provided goals. Communication helps team members to converse with each other and learn from each other. Through communication, team members learn each other and build good working relationships that promote collaboration. Furthermore, the recognition strategy can be used by leaders to improve teamwork, according to Sullivan, Kavosky, Mason, Hill, and Dukes 2015. This would involve leaders identifying the hardworking health professionals and rewarding them in several ways. It would satisfy nurses and promote good rapport between the organization's management and the nurses. Therefore, all nurses would be willing to collaborate to be rewarded. I agree. Sharing an internal transparency is another strategy that leaders can use to improve collaboration among healthcare providers. Leaders who share internal transparency, especially set goals, costs, profit, and other essential factors of the organization, are prone to improve teamwork and other team members. It makes them feel like they are a part of the organization and become satisfied. Finally, collaboration strategy would also be useful and can be used. Multidisciplinary collaboration makes healthcare providers feel motivated and safer to work freely. It enhances togetherness and teamwork, resulting in positive patient outcomes and professional satisfaction. Multidisciplinary collaboration is essential in the care of patients to achieve patient outcomes. However, healthcare professionals need to comprehend the best interdisciplinary collaboration strategy for effective outcomes. First, healthcare providers require communication skills for them to work as a team. There are a lot of giving and taking instruction and orders when caring for a patient. Therefore, communication is significant in collaboration. Additionally, effective communication strategies would help the team to create a good working rapport among the professionals. Xi, Wu, and Ching 2017. Another best interprofessional collaboration strategy would be the use of leadership skills and management. For a team to collaborate properly, a coordinator is required and a leader. The physician is in most cases can lead while nurses manage the situation. Leaders with effective leadership capabilities lead others to provide quality and safe healthcare services that improve patient outcomes. For example, a democratic leader would enhance collaboration among the team since the members are given time to share their opinions and suggestions concerning healthcare. And in conclusion, it is very vital and significant that the organization educate the team members with the interdisciplinary collaboration and leadership in the healthcare system. I want to thank you so very much for listening to my video. Again, my name is Alice. Again, thank you.